Hi, I'm Dr Eccleston. I'm a doctor of 30 plus years experience, and I'm the clinical director of Medizen based in Sutton Coldfield in the English Midlands. My speciality, originally I was an NHS GP with an interest in weight management and in diabetes, and for the last 3 years I've been focusing on helping patients maintain an ideal weight through a combination of dietary advice, exercise and Saxenda injections. I first heard about the Elipse weight loss program a couple of months ago, and previously patients had tended to shy away from the idea of having gastric band surgery or a gastric balloon inserted and removed via an endoscopy. The thing that most appealed to me about Elipse was that unlike other gastric balloon type devices, it's swallowed in the form of a capsule, inflated by the treating doctor, and then after 4 months it spontaneously deflates and is passed through normal bodily functions. In my experience, patients like the idea of the Elipse balloon because it doesn't require surgery and also it doesn't require endoscopy to insert or remove the balloon. The patients that we've had so far, after a few initial days where they've been feeling a little bit sick and not like eating, the weight loss has been quite significant. One of my patients has been losing a pound a day for the last 14 days. So the device itself is contained within this capsule, which is the size perhaps of a large vitamin pill, and certainly when you look at it initially you do think it's going to be difficult to swallow, but all the patients I've treated so far have had no problem in swallowing, and if they did have a problem then we can insert a fine wire into the catheter to make it a little stiffer, and that then allows me to assist in the swallowing process by easing it down into the esophagus. Once the capsule's been swallowed and comes into contact with the fluid in the stomach, we make sure that it's in the right position by taking an X-ray, and once we've confirmed the location we then inflate the capsule itself and it becomes this balloon here. And this is filled with 550 cc's of saline, which contains a small amount of a food preservative, which over a period of about 16 weeks will cause weakening of the seal, which is held in place by a simple suture. The suture then pops and the balloon spontaneously disrupts and collapses and then is passed through normal bodily functions. Very occasionally some of the patients at the end of the treatment can actually vomit up the balloon, but that's usually only 1 or 2%. But unless you know that that can happen, sometimes that can be a little bit of a surprise. One of the things that the patients who come to see me are bothered by is the fact they've tried everything else. They've tried diets, they've tried exercise, they've tried the latest fads, but unfortunately very few diets nowadays you can actually adhere to for life. So this is not as simple as just placing the capsule and inflating the balloon. We need to change behaviours. So as part of the entire Elipse balloon program, we put the patients in touch with an expert dietitian who will advise on simple steps that can allow them to permanently change their relationship with eating and with food and enable them to maintain a healthy lifestyle. What that also means is that even though the balloon is gone after about 4 months, at 12 months with that appropriate support, 75% of the weight lost stays lost. So by changing behaviours, we maintain the effectiveness of the treatment. Average weight loss is perhaps 10 to 15% of body weight, which translates into 10 to 15 kilos or 20 to 30 pounds of body weight. And if the patient is particularly large, then there is the potential to have a subsequent balloon fitted after a month or two, free of the balloon inside the stomach. As well as the placement of the device and the appropriate dietary support, the company that manufactures the balloon also provides an app. And the app is personalised to the individual and it allows you to track the progress of your weight loss. That's tied into a special scale which the patient is asked to record their weight at least once a week. The app is then programmed to transmit the changes in the body mass index, body water content, body fat content, BMI and so on and so forth, which then goes to the supervising physician and or dietitian so the weight loss can be actively tracked and any patient who may be struggling with the procedure can be appropriately advised and ensure that they're kept on track.